Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Tracy, over the past 50 years, I don't know if you've noticed, but the role of the pharmacist has changed. It's evolved, and they don't just dispense medications anymore. They're not just pill pushers or pill counters. No.
Yeah, there's a much bigger role than ever before.
So true.
They're medical counselors, educators, and patient advocates, and they're giving shots. They're giving vaccinations. Joining us in studio to tell us more about all that they do on our behalf is Mayo Clinic pharmacist, Ms. Victoria Zambito. Welcome to the program, Tori. It's very nice to meet you.
Hello. Thank you so much for having me.
So you must be a busy girl. I mean, there are 4.5 billion prescriptions filled every year in this country.
Yeah, it's pretty incredible how medicine has evolved over the years and how we have so many more prescriptions to treat illnesses out there. So naturally, the number of prescriptions each year is going to rise.
You think people are taking too many prescription drugs? Because just let me mention to our audience, close to 50% of people between the ages of 70 and 79 are taking 5 or more prescription drugs. Polypharmacy a problem in this country?
It can be. It definitely can be. And I think the main issue has to do with continuity of care. So when patients have several different illnesses that they're trying to manage and they see these different specialty physicians for each condition, maybe not everybody's on the same page or has the full picture or knows all the medications that patient's taking. And so, yeah, sure, polypharmacy can be an issue that comes in there with duplicate therapy, but that's where pharmacists can kind of come in and intervene, review everything, and make any changes that are needed to prevent any therapeutic overkill.
Does polypharmacy mean multiple medications? Is
sure
that what that means?
Yeah.
Well, there you go. I learned something new today.
So it's MTM. Tell us about MTM.
MTM, so Medication Therapy Management. That is a program that is covered by Medicare Part D. And so it's specifically for patients who are taking, I believe, 7 or more medications for at least 3 chronic conditions. And then, so Medicare Part D will cover these counseling sessions with a healthcare provider, and it's usually a pharmacist. It doesn't have to be. But so basically the pharmacist will meet with the patient, go over their conditions, the medications, the best way for them to take them, that's easiest, and for them to remember to take them. Other lifestyle factors, diet, exercise, and then just kind of follow up with them.
So you said you have to be taking 7 different prescription drugs and have 3 separate chronic conditions.
And that sounds like that's a lot, but you would be surprised how many people actually have
Incredible.
7 or more. Yep.
Huh?
What is, first of all, what made you want to become a pharmacist? How did you get interested in this?
Sure. Actually, that's a great question. So I started out in business and Spanish, believe it or not, a long, long time ago. Thought that was a little too broad for me, and I had a friend who was in pharmacy school. And so I went and I kind of shadowed and I learned about pharmacy, and I really was drawn to it because I knew right off the bat that there were so many different ways that I could use that degree. So a PharmD can be used in the hospital, can be used at your local retail pharmacy, It could be in industry or research, or there's just various different opportunities for a pharmacist. And so I really loved that kind of well-rounded aspect.
What is the typical day in the life of a pharmacist?
And you are a hospital pharmacist.
I am, yes.
So
I work inpatient. So I'm taking care of the patients that are currently staying in the hospital. And so that could be anything from going and speaking to the patients about what the medications that they take at home and making sure that we can provide those here while they're here. Going over allergies and looking for drug interactions and making sure that medications we do give here are the right dose and the right indication. And then also like monitoring for things like antibiotics, making sure that the levels in their body are appropriate and making dose adjustments as needed.
So you actually go into patients' rooms and speak with the patient, speak with their family.
So a lot of pharmacists do that. Specifically, I see patients going into surgery. So I'll see them kind of on a floor where we have them reserved for their transition into surgery. So I'll see them beforehand so that when they get out of surgery, everything's all set up for them and ready to go.
Have you ever worked in a non-hospital setting, like at a Target pharmacy or a retail pharmacy?
I haven't. I've done rotation experiences in school there, so I am familiar with what they go through and what their processes are like, but I haven't outside of school worked.
Well, here's my question, because when I go to pick up a prescription, the number of people, and I like it that the clerk always says, "Do you have any questions for the pharmacist?" I hardly ever have seen anyone say, "Yes, I do."
Sure.
So I'm going to assume that you would advocate that people do take that moment to pull that pharmacist aside when it's been offered to them. What should people talk about with their pharmacist when they're picking up a new prescription?
Absolutely. I think it's something that people can often take for granted, but a pharmacist is a doctor that they can walk into the pharmacy at any time for free and ask questions, and more times than not, they'll probably have some kind of answer for them. So whether the patient's having issues with side effects or something's just not working for them or they're having trouble remembering to take their medications, there's so many different things you can ask a pharmacist.
Well, that sheet of paper that comes with it is, and I say one sheet of paper, sometimes it's 2 sheets of paper that come with a prescription that talk about the side effects and different things. That's a lot to manage if you have 7 prescriptions.
Absolutely. And it's a lot to remember. I would never expect a patient to remember, what every medication they take is for even. That because the names of medications can be pretty wild and hard to pronounce and hard to remember. And so, that's what a pharmacist is there for, to help break it down for them and make it as easy as possible.
The one thing that you pharmacists at a particular pharmacy probably don't know, if the patient has gone to multiple different pharmacies, you don't know all the different medications that they're on, right?
Well, so if they've gone to multiple different pharmacies, sometimes we can look and check and see if they've gotten prescriptions filled at other pharmacies. It kind of just depends. And then we can contact their providers and get a bigger picture.
Oh, you can.
Absolutely.
So then, because the big question is, if they're coming in for a new prescription, is that going to have some adverse interaction with the other ones that I'm taking? But you can get that information and help answer that question.
Absolutely, yeah.
And you guys give vaccines. Shots.
Yeah, absolutely. Yeah. So in Minnesota, I believe that pharmacists can vaccinate anyone 6 and up for flu vaccines, and then 13 and up for all other recommended vaccines, as long as it's under assigned protocol by a physician. And so that's really neat. And people can walk in and get a vaccine at their local pharmacy.
I was looking forward to speaking with you today because you listened to our new Mayo Clinic podcast, which is Mayo Clinic Q&A, little bitty commercial there, teeny tiny, and reached out to us and said, "I want to talk with you about being a pharmacist." And so you must be pretty fired up about helping people through pharmacy.
Yeah.
Why did you reach out to us?
I thought it was an amazing platform for a pharmacist to speak out, because I think a lot of times healthcare is constantly evolving and pharmacy can kind of take a back seat a little bit. And I think that, we've got just as much to offer as anybody else. So I want to make sure that people, especially patients, know that we're a resource and we're an accessible resource that they can come and utilize at their discretion.
Do you happen to know what the number 1 prescribed drug is in the U.S.?
I do. It is levothyroxine, or Synthroid.
So how about number 2?
That's
Number
me.
2, I think it's one of the statins. I think it's a atorvastatin now. I know they do that
for high cholesterol.
Yep, for cholesterol.
That surprises me.
Yeah.
Now, there are some drugs now that a month's supply will cost $50,000. Does that concern you?
It does. I mean, insurance typically helps a lot, but I understand that not everybody can afford insurance. And so, it is definitely a difficult thing, because from our standpoint, we want patients to get medications. We want them to have the care that they deserve and need. But
what do you think about generic drugs? Are you pretty convinced that they're as good as the brand?
Absolutely, yeah. So most of the time, we do recommend switching to the generic. There are certain things that I might be a little iffy on, like your over-the-counter eye drops, things like that. But for the most part, go get your generic acetaminophen, ibuprofen. It's all the same, pretty much.
Is it?
I think we should invite her to be our official pharmacist.
All right.
Hey,
you are
absolutely.
the official
I'm here for
pharmacist
it.
of Mayo Clinic Radio.
Yes.
Your mom is going to be so proud.
Oh, I can't wait to tell her.
Well, certainly they do more than just count pills. Pharmacists are now an integral part of the healthcare team. Our thanks to Mayo Clinic pharmacist Victoria Zambito. Thanks so much for being with us.
Thank you.